Pillar 2, student engagement. Health Services has developed a number of advisory groups and roles in order to increase student engagement. In addition to having a VP of Student Health in the student government, there is a Student Health Services Advisory Committee, as well as a Student Peer Health Program. In all, there are 16 student employees in the Health Services Department, all serving as student health and wellness ambassadors.
Another benefit of student engagement is we know when students get engaged, get involved on campus, they're more likely to do well in their classes and feel connected, especially at a community college where we don't have students living on campus, we don't have dorms, and we know a lot of students say they at first feel disconnected or lonely, but we see once they get engaged, whether it's a club or joining student government, it's protective for their mental health also, because they have a community and they feel like they're contributing, and that promotes good health all the way around. And I work more closely with the peers, and they're really our student face of health promotion and outreach. So they're out and about on campus, bring out their wheels of wellness, put on events, do classroom presentations. The program I work with and the peers, we do a lot of promotion around mental health, trying to both decrease the stigma around mental health and increase awareness. We often will do an event around stress, a mental health issue that every student experiences and wants to talk about, learn some tips. Sometimes we'll put on a specific workshop around suicide prevention, depression. We bring in guest speakers. Sometimes it's also just more simple pop-up. There's a club day happening on the quad. Let's just be there and see what questions students have about student health. One way we get students to engage back is, again, having so many students involved in student health.
The student engagement program, they've kind of taken over the food distribution part, and so it makes it a little more student-friendly and acceptable to the students because they make it more of a party atmosphere to get food. Also, student equity has been involved in kind of base funding the pantry. They wrote a grant that we've participated in to merge that program with CalFresh enrollment.
It builds community, it adds to the vibrancy. More people involved lends itself to a community that is aware of what's happening. You're bringing in more ideas to the community, more innovation to the community. It makes the community a more fun, healthy place to live when more students are involved. Engagement leads to greater student development and retention. Students are more likely to stay here longer and complete their goals if they get engaged, because they're making connections with other students, faculty, staff, programs, activities, and that's really important to their success.
At Santa Rosa Junior College, these 8 pillars provide a strong foundation that structures all aspects of student health. These 8 pillars are designed to help create a healthier and more successful student community.